All right, we may still have a few more people coming in, but we're just going to go ahead and get started. Again, welcome everybody. Thank you for joining us this afternoon. We are very excited to have Dr. Nordness with us to go through an overview of the Munroe-Meyer Institute clinical services, and then also kind of how to access them. So just to begin, this information series is brought to you by our Family Care Enhancement Project, which is, we have parent resource coordinators who are parents of children with disabilities, and we have specialized training to help parents get connected to different resources and information needed. We also help when we're placed in clinics to help those clinics meet the social determinants of health and the outcomes. And here we are, our Family Care Enhancement Project is statewide, which means that we help families throughout the state. And here are the locations where we have a parent resource coordinator, at least one. Some locations we have more than one. And just some housekeeping here. We are recording this webinar, and it will be available on our on MMI's webpage under the Family Care Enhancement Project, and there's the link there. It usually takes us a little while to get the video edited and then uploaded to the website, but I will send out the link for that in the follow-up email for everybody who registered. We will have time at the end for questions and answers. So if you could just submit them, any questions that you might have or comments via the chat function, and we can get those answered for you. And then I do have a short survey just at the end when you go to exit the presentation. It will pop up, and if you could just 4 questions, I believe, but just a satisfaction survey for our funders. And then without further ado, we'd like to welcome Dr. Amy Nordness, who is the Director of Clinical Services here at MMI.
Thank you, Jennifer.
Yes, I will stop my share and hand it over to you.
Thank you. Just one more housekeeping thing for me. Do you want me to monitor questions coming in? Will you monitor those?
I can monitor them.
Okay.
Yeah.
And if anything seems pressing from time standpoint, feel free to interrupt throughout. I'm happy to take those questions throughout, but I have some time saved at the end for those too.
Okay.
All right, let me go ahead and get my screen shared. Okay. That popped up okay, Jennifer? Can you let me know?
Yes, looks
Perfect.
good.
Great. Well, thank you so much for having me today. I really appreciate it. I know that there are lots of services at MMI, and we have big vision to expand even more. And so I think that it can be very confusing at times to kind of make sense of all that. So I'm happy to try to shed some light on that today. Just wanted to let you all know my background is as a speech pathologist. And so from that rehabilitation standpoint, I have a lot of information that I can add as well, but I have transitioned into the role of leading all the clinical services at MMI. I'm also the associate director at MMI at this time. What I tried to do today is break these down into some categories that might be a little bit easier to make sense or understand kind of how they all fit into the big picture at MMI. Really looking at about 7 kind of chunks of types of services here at MMI. Our first one is our outpatient clinic. And I also tried to put these in how it would look as family members coming into this building too. And so come into our outpatient clinic, we have our Integrated Center for Autism Spectrum Disorders. We have a bucket of very specialized services here. We have our severe behavior department, recreation therapy, and then we have a clinical support entity for our families. And then some new community partner services as well. So if this kind of breakdown helps organize things a little bit better, I do want to elaborate on all of these, but I think this might help make sense of the different services we offer. So really, when we're talking about our outpatient clinic at MMI, this is the typical stuff that we have offered for quite some time at MMI, things that you would usually go to a clinic for. So we do have medical services here in our building. These are not regular routine PCP types of services. These are more specialized medical services right now. So we do have developmental pediatricians at MMI that allows our children to have a specialized medical evaluation for those kids who have developmental and behavioral needs. It could be related to medication questions. It might be related to overall development, but really kind of that specialized look in addition to all, seeing their PCP elsewhere. We have a very large genetic medicine department that provides a lot of ongoing support for individuals who have a genetic disorder, provide that initial evaluation, really looking at what that challenge might be, just helping identify that in the first place. But even after maybe a diagnosis has occurred, kind of having either the genetic physician or the genetic counselors help families a little bit more related to providing some advice on recurrence risks or understanding what those causes might have been, or identifying new resources to connect you with. Now that there is a specific genetic disorder, that there might be some resources out there that that can help families. And so they also will help connect you with all of those things that come after that initial evaluation component. We do have nursing services in this building as well. And our nursing team really supports our medical team. So they are working closely with the developmental pediatricians, with the genetic medicine physicians, but they're also a great support for the rest of the team at MMI. So if a child with some significant medical needs comes in for a therapy appointment, we do still have our nursing team that can provide some support to us at that time. One other clinic that we have in the building right now is our TIPS clinic. And this is for our NICU follow-up. So for those children that have graduated from the NICU, that neonatal intensive care unit, many of those kids do screeners after that. Some of the kids come to an actual clinic. And so those clinics are held in lots of different locations across the state and across Omaha. One of those locations is here at MMI. So we do see kids in our TIPS clinic coming to this building. We also are in the process of starting a new clinic. So this is something that we hope to have by the end of the year. This is our neurometabolic clinic. So this is going to be a combination of our genetic medicine as well as a neurologist teaming up to really support those families who have children that have difficulties with breaking down nutrients to support that brain function and development. So that is a clinic that we're really excited about coming before the end of this year. Outside of our medical services, the four kind of traditional therapy services that families oftentimes come to MMI for are speech language pathology, occupational therapy, physical therapy, and psychology services. And so all of these are run through our outpatient clinic. Speech language pathology, oftentimes kids will go see that speech pathologist if they have challenges with their speech development. Some kids who may not be able to talk, we get them set up with speech devices so that they can have that mode of communication that's their own. So whether it's speech or non-speech, we are making sure kids have communication systems established. Any questions about language, voice, swallowing, and we also do a lot of parent communication training. So a lot of the things that we know help kids learn to develop those speech and language skills, we have a very structured program that we can teach parents how to get those skills and continue to support those at home. So oftentimes kids are having a combination of getting the therapy themselves with their SLP, but also then having the family go through some of that parent training so that they can continue to support those same skill sets at home too. Our occupational therapists support children who have difficulties with fine motor, a lot of hand function, finger grasping, those types of skills, to do basic activities of daily living, a lot of like self-feeding that may come into that component too, or even kids who have a lot of different sensory needs, our occupational therapy team works with. From a physical therapy standpoint, these children are, our PTs are working with them on those big motor movements, walking, crawling, standing, but they're also working on strength, endurance, and coordination. So thinking about those big muscle movements and mobility. From a psychology standpoint, our team is really supporting those kids who have behavioral, emotional, or cognitive difficulties. Oftentimes, the things that we see families come here for, and our team has a lot of specialty skill training in, is difficulties with attention, difficulties with sleep, toileting, might have challenges within school system, even some pain management. Are all things that fall under the psychology realm. And so all of these types of services are medical, speech, occupational therapy, physical therapy, and psychology, all run out of that outpatient clinic at MMI. So a separate arm at MMI is really all of our services for kids with autism spectrum disorders. And that falls under our ICASD. That I stands for integrated. We're really trying hard to make sure that for kids with an autism spectrum disorder, we're putting all of their needs in one area. So we're doing a lot more work into coming to that autism program, but then pushing in services within it. So one example is the speech program. Oftentimes kids with autism need speech services too. So instead of making families come to an appointment in our outpatient clinic for speech, that speech pathologist will push into the Integrated Center for Autism Spectrum Disorders and go to where your child is so that we're connecting everything in a much better way. So we're really trying hard to integrate those services under one umbrella. In our ICASD department, we do evaluation for autism spectrum disorders. So this could be ruling in or ruling out. We don't know for sure if they may have autism or not, but the evaluation can be completed so that we can know yes or no, that we can either get you connected with services sooner. There's a lot of parent training support that this team offers. And then they do some very structured behavioral treatments. And there's a little bit of a difference based on age of the child and when that starts. So we do have specific treatment programs for toddlers. Those are our ACT clinics, and that stands for Autism Care for Toddlers. We do have 2 ACT clinic locations at this point in time. We have one at 90th and Q. That's kind of our original ACT clinic. That's how the name started. We now have a second location, our Action Clinic, that is in Omaha North. ACT in Omaha North is where that got that name. So we have our ACT Clinic, our Action Clinic. They're exactly the same type of service for both for toddlers. They're just in different locations across Omaha. We really want to get people a little bit more connected within their home community to provide these services, which is why we're pushing more out into the community for these versus being in our main building at Exarban campus. We are looking to expand this network. And so we're looking at future clinics. And so as we see needs in populations around Omaha, providing more rural supports in Nebraska, spreading further out west, these are clinics that we hope to expand over time and have this network reach throughout Nebraska. Once kids reach kindergarten, school age, really those services change a little bit, and we want to get them into more of our early intervention program. And I know that this name can be a little bit confusing. Typically, we think of that early intervention as our birth to 3, but as our naming of our program is currently at MMI, our ACT clinics are for our toddlers, and then our school age services are that early intervention clinic at our main building at 69th and Pine. So it's still very structured behavioral treatment. Work closely in conjunction with our school systems. If kids they might go to school for half a day and then come to MMI for half a day, but we're working closely with that school system to provide services that they need that are very structured behavioral approach. So we do have a lot of very specialized skills, and there is if you come into our main building at Scott campus or in the Exarban location, we do have an area on our second floor that is just for specialized services. So really unique things that not just anybody can do. And so we offer some very specialized services. One is pediatric feeding. So for kids who have either limited intake of food overall, they may be a picky eater, they might be dependent on a tube to meet their nutrition or hydration intake. They might have sensory aversions to eating or reduced feeding skills or some poor mealtime behaviors. All of those needs, if they have really are extensive enough that has limited overall intake, our pediatric feeding department, a great approach to working towards regaining those developmental feedings again and getting that intake increase and getting off tube feedings. This is a combined approach between our behavioral approach, our BCBAs, as well as, excuse me, speech pathology is part of this team, as well as a dietitian. And a couple of our team also are licensed psychologists. We have a GI, gastroenterologist, visit on the team as well. So it's a pretty extensive team to really support all those needs that kids may have related to feeding. We also have a voice specialist here at MMI. So anything related to vocal cord movement and function, whether it's impacting breathing or talking, we have some specialized equipment to look at that vocal cord function, and one speech pathologist that primarily works in that area. We do a lot with assistive technology as well. And this can extend across many departments, but we do have one program that is purely within assistive technology, and that's our virtual reality program. So a lot of our teams have been working on teaming with our assistive technology team to maybe practice things in a safe way. So some examples have been practicing getting a haircut, practicing getting on an airplane. Those are things that you can create a virtual reality environment for to make it easier to learn. Another thing that they offer in the summer, our PT OT departments partner with the assistive technology program to do some camps that are intensive work on like induced therapy. So really focusing on using one side of or kids who may have limited use of one side of their body. We're really encouraging that use of that other side in a virtual reality environment. So we're doing some nice collaboration between our PT, OT, and assistive technology teams. We do have aquatic services in this building too, and those can range between something that's a little bit more therapeutic and something that's a little bit more for and leisure. So our physical therapists and occupational therapists have specialized staff who have certifications in therapy. So many of our kids are working to their therapy goals in the pool, and can do that from a therapeutic approach. If you're interested in participating in aquatics more for fun or leisure, learning how to swim, our recreational therapy department works with those kids as well. And so we have a lot of different options. We have two different pools in the building, one standard temperature, kind of that cool water that everyone's used to in a regular pool, but then we also have a warm water pool. So if some kids need that warm environment from supporting their muscles and relaxation, we do have that type of approach as well. We do offer nutrition services here in the building, Primarily, our nutrition pushes into our pediatric feeding program as well as our genetic program. But there are some outpatient services that they offer as well. One thing that I'm really excited about that's coming up is next spring, our registered dietitian is offering a camp for young adults that have some nutrition needs, kind of working on picking out those foods and cooking themselves. And so that's an offering that we will be bringing this spring. We do offer car seat assessments for kids who have very specialized needs. Their muscles move certain ways that maybe a standard car seat doesn't work for them. We do have certified therapists who can get you set up and make a recommendation for a car seat that is better fit to support your child. Our PTs and our OTs also help with identifying equipment that might help kids' mobility. So maybe some braces, we oftentimes call those AFOs, or ankle foot orthoses. They might be needing a walker or a wheelchair or stander, any of that type of equipment in order to help those kids learn how to move those muscles in their body, help them become more independent ambulators, whatever way they do that. We can help get you set up with that right equipment. Our physical therapy and occupational therapists also have a specialty certification in pelvic floor therapy. So for individuals who are working towards some of that sexual health, maybe our adult IDD population is needing a little bit more support in that area, that we do have certified therapists to help in that area too. Our severe behavior program kind of has its own entrance to the building. They have their own department that has really specialized skills. There are very few of these across the nation, and so have really developed this program to be a very specialized, unique support for kids who have severe behaviors. They offer evaluations to determine if a child's the right fit for this type of program or not. So if you're not sure, you can always do the evaluation and find out if that's something that your child would qualify for or not. After the evaluation, there really are two treatment options. There's an intensive outpatient program, and there's also a day treatment program. So maybe the day treatment is not the right fit. Maybe the intensive outpatient is a better need. Typically what we see, I wanted to just throw out some of the criteria out there. So most of the kids that we see in our severe behavior program have one or more of these specific types of daily behaviors. They happen regularly every day, and that's what really qualifies that need. But we might see aggression, elopement, so running away. There's injury risk behavior that might occur, oppositional behavior, pica, which is also eating things that are non-food items, property destruction, or self-injurious behavior. So these are the behaviors that usually qualify kids to be a part of our severe behavior program. Typically, we see out of a severity level of 4 in our outpatient program, these kids are usually at a level 2, and the risk is pretty serious. We also see that it's starting to cause significant stress on the family. 2 other components that need to be met in order to qualify for this type of service are that they've tried at least 3 months of outpatient behavioral therapy somewhere without success. So insurance companies aren't jumping right in and paying for this. It's a pretty intensive program. And so they want to see that we've tried something that is least restrictive first prior to jumping into an intensive outpatient program. Additionally, our insurance companies require that they have at least trialed 3 months of medication without success. So that is, if those criteria are met, child can qualify for that intensive outpatient program. The day treatment then is even a little bit more specific. So intensive outpatient, typically we have our kid maybe in school for about a half a day, and they're coming for intensive outpatient the other half of the day. They still benefit from that connection with their peers and being in that school environment. For our day treatment, typically it's not a safe place for those kids to be in that school environment right then. And so they need to be in the program for that full day. It's a good 6-hour chunk of the day that they are participating in the treatment. So the criteria to meet for qualifying for day treatment is everything that's above and then at least one or more of the following that either jumps up to a severity level of a 3 and it's an imminent risk. We're seeing kids maybe have self-injurious behavior towards a vital or vulnerable body part, say like the eye. They might be starting to aggress towards young children that maybe who can't defend themselves. It's really a struggle to interact with peers and at school and in the community for safety reasons, and also aggression that might be directed towards a vulnerable adult. So we don't want to jump straight to this type of a program right away. We want to make sure that we've tried all other options first. So in that evaluation, we're kind of looking for what needs to the child and family have right now. What have they tried? What did they qualify from an insurance standpoint? And so that's really why that evaluation process is really needed. So the next bucket that I really wanted to focus on is our rec therapy program. So recreational therapy is all about leisure and fun and helping kids and young adults find those outlets that that are those just that can help them get that lifelong leisure outlet for kids and find something. So there's a little bit of everything in this department. So there are some programs that are specific for kids, and we're really looking at that 3 to 21 range. For adults, we have some that start at 18 and some that start at 21. But there are some separate programs just for adults. And there are some that are for both our kids and our adults at specific ages. So I listed a lot of these here. I'm not going to go into a lot of detail about all of them, but really just wanted to see a few variety of those. That there's a lot of programs on adaptive sports, art, outings in the community, garden club. We have a garden at MMI. So some of our adults will grow their own food in the garden and then pick that food and bring it into the kitchen, learn how to cook that food themselves. And so it's this really nice garden to table approach where our adults can participate in that food process the entire step of the way. Our wheel club is always a favorite with those adapted bike rides across the community. Camp Munroe in the summer is for our pediatric program. That's always a big hit, and it's probably our busiest time of the year with camp. And for both, we do have theater, arts, and music workshops. We started those prior to the pandemic, and we are really trying to get those back going again. It's that pandemic really changed some of our processes, but we're really trying to pick some of those services back up again. So even though we have a lot of different types of services here, we know that our families need more support in accessing them and getting them set up. And so our clinical support bucket of services we offer here is really to kind of just help all of our families get the tools they need in order to get into MMI and get services and work through their insurance companies, as well as connecting them to different services that are out there, different resources. So our patient information office, we call that PIO for short. You might hear the team at MMI talking about that. But they're our center that we want all of our families to start with. They support all of our scheduling. They support everything related to insurance and getting referrals and making sure that we have what we need in order to get services here at MMI. So that is really our hub of where we want families to feel like they can start. Our care coordination program has our social workers, our parent resource coordinators, as well as our interpreter services within this program. So that team is really strong in supporting just case management. Sometimes our families need help, like if they're receiving a bunch of different services at MMI, our care coordination program, our PRCs or our social workers really help connect that whole team to make sure that we're functioning as a unit versus individualized services. They also are helping our families identify and locate state resources, maybe some things that our families would qualify for. They want to help them know what's out there and what they need to do to get set up. And if the wait list for those services is long, let's get you set up early. So by the time you need it, you'll be ready to go. They also can help connect you to different resources at MMI. So if you're not sure of like, well, I think that this might be what my child needs, I'm not really sure, that social worker or the parent resource coordinator can help you work through some of the nuances of what the different services are to know what it is that your child is really would benefit from. This team also can help answer questions about insurance, waivers, school questions, legal systems. So they're pretty well versed in all of those unique roles. That they're a great resource for our team, for our families. They also can support from coordination with our community partners and other care providers. So if we need to get our school teams connected with our team at MMI, our PRCs and our social workers can really help make those connections and get us all communicating in the plan together in one. Also, if they offer some crisis support too. If a family is really struggling with an event that just occurred, this team can really help in that moment. Our interpreter services housed within that care coordination program as well. We do offer in-person Spanish interpretation as well as over the phone. So this is our one option that we do have in person for Spanish. We do offer interpretation for all other languages, but those are all available via the phone. So we would use a speakerphone link so that we're connecting with an interpreter that speaks a language that maybe that a family prefers or relies on. We also have video interpretation for American Sign Language. So if someone uses ASL as their main language, we do have video interpretation option for that. The last bucket at MMI, when we think about the different types of services here, are things that we're not necessarily providing ourselves as MMI employees, but we know that these are important to our community and we want to help get our families connected to these valuable services. And so we've offered to have those services in our building. So our dental clinic is run by the UNMC dental program, not MMI, but we have created a space for them in our building so that families can access that all in one place. Same with vision. Our vision services are provided by Trulson at UNMC Nebraska Medicine. We also are expanding to add audiology services here. So we are partnering with Boys Town to bring audiology and hearing tests to MMI, as well as an epilepsy clinic. So we're partnering with Boys Town to bring an epilepsy clinic here to MMI. So these two we hope to have maybe by the beginning of January in order to have these services for you. They'll be right at MMI. We'll support that process here. It'll just be provided by someone outside of an MMI employee. So I think probably the biggest challenges outside of just knowing what MMI offers, since it's so extensive, is how do we get connected? How do we let families know what's out there and how do we get them set up with the right service? And so this is an area that we've really tried to make a lot of improvements on. We still have a long ways to go, but we are trying to simplify that process for our families. Really, we want one place that everyone can call in order to get you connected with everything. So PIO, our patient information office, is that hub. I listed their number there. 559-6418. That is the best place to start for anything you need. And if the patient information office can't get you set up right away, they at least will direct you to the place that you need to go. So if you have to remember one number in order to call to get services at MMI, this is the best place to start so that we can get you connected to what you need. Our the other main challenges that we work through when it comes to getting services is that many of our services require a prescription or a referral from your doctor before we can schedule. So your insurance company won't pay unless there is a prescription or a referral on file. And that is something that we know we spend a lot of time trying to stay up to date, current with all of the insurance regulations. And so when you share with us what insurance company families have, that we know some of the specific details from those so that we can make sure that things are working appropriately with your insurance guidelines. So we do try to help get you set up with those services, but do track down those prescriptions or referrals before we can schedule. If a family needs interpretation support during that scheduling process, we can get someone on the phone in order to help offer that interpretation during the scheduling process too. We may not know until they call, but once we realize that interpretation is needed, we can get that phone service started so that we can help support scheduling in that way. If a family calls into our patient information office and they don't really know what it is that they're looking for, sometimes families tell us, like, my doctor told us to call, I'm not really sure what they wanted us to get connected with. That's really challenging to know that out of all of these things I just told you that we offer at MMI, how do I communicate that to someone in order to get set up with the right service? If we don't know, if the family doesn't know, if this person on the other end of the phone in our patient information office doesn't know, the best thing that we can do is just get you connected with someone in our care coordination department. They can do a phone call with the family and really work through of what is it that you're looking for? What do you need? What do you want? And really get to the heart of what's the right service to start with. It might be that there's more over time that are needed, but at least getting someone started, getting them in the door, and then our providers can help make recommendations for other services that might be needed. So we don't want to leave families hanging if we don't know where to start. Best connection there is get connected with someone in care coordination and they'll help that process. Our patient information office is also going to verify if we are in network for your insurance provider. So that obviously affects payment and reimbursement pretty extensively. So we want to make sure right away that you know upfront if we are considered in network or not. So we will support families through that process. We do have different payment options. Most of our services here at MMI are billable through insurance. And so we want to check all of these requirements, get the prescription, get the referral, get authorization done, make sure we're in network in order to make sure we can bill through insurance. If a family doesn't have insurance, that doesn't mean that they can't come here. But we do have a self-pay option that is discounted because families are self-paying. And so we don't want to not allow families to access those services. So we do have that self-pay option as well. If services aren't available right away, if we have a wait list, our patient information office is where we can get at least families on that wait list so that when an appointment time opens up, we can get a family in the door. Some of those wait lists can be long, but not all of them are. And so I think it really depends on the service that you're looking for, how long that wait might be. So one area at MMI that does not go on through insurance is our recreation therapy program. So that is not an insurance billable service. What they do in rec therapy is really provide classes that have class fees, just like you would go to any other institution or go to the Y, have your kid pay to be a part of a class there. That's how our recreation therapy program runs. So they have different class fees. For families who may not be able to afford some of those services, there are scholarship funds available too. So it really doesn't hurt to at least start and ask some of those questions about getting connected with some rec therapy classes. For our rec therapy services, because they're not going through that traditional insurance process, we usually have our families just reach directly out to rec therapy. And that's that number listed there, 559-5777. Gets directly to our rec therapy program to kind of tackle classes and fees, scholarships from that different entity. So I know that getting into certain services at MMI, it hasn't always been easy. And that's something that I really want to make sure we're continuing to do a better job at. So some of these are the big items right now that we're working on at MMI to improve access, and to our clinical services here. So one of the things we've really been putting a lot of work into is centralized scheduling. In the past, I know that every department kind of managed their own work. And so families had to remember who to call and which department is this. We are really trying to do away with that and making that one point of contact to call. So that's our patient information office that we talked about earlier, having everything work through one location. I would say we're not 100% yet, but we really are doing a strong effort to get everything into our patient information office as soon as we can to make this easier for our families. We do have a challenge with our wait list right now. I know that that can be a frequent complaint of our families about services at MMI. And so there's that we're trying to do about this. And it is a lot of different options. So first and foremost, like keeping our waitlist current. Sometimes families decide to go elsewhere, or they get in somewhere faster, and oftentimes they're still sitting on our waitlist. And so our numbers might look more inflated than they actually are. And so we're really working hard to keep that waitlist current. So we really know who's still trying to get in for services here at MMI versus it just being a list that has gone on far too long. Another way that we're trying to reduce that wait list is to expand our current services. For those services that families are waiting a really long time for, we're really trying to add more. This is a long process because it takes hiring new staff members. It takes training them up. It takes supervisor level. It takes front end level. And so there's a lot of hiring that's happening right now at MMI. So that we can expand those services and start to really work through those wait lists and decrease those overall. We're also trying to add new services. We're constantly talking to our families and asking them what needs are out there and start bringing some of those services into the building that maybe we've never offered before. And that's where you're seeing some of our community partnerships come in. That families have expressed the desire to have some of those services, and we're listening and we want to be able to provide that. And so we're bringing those new services as well. It might be a new specialty service that our team at MMI wants to offer. So like, for example, our neurometabolic clinic, that is an MMI service that has been something that has been quite a need. And so our genetic medicine department is in the works in developing that. Another thing that has impacts our wait lists and services too is cancellations and no-shows. We do have many cancellations, many no-shows. We're really trying to work through decreasing that so we can make better use of the time here, or if we know of those coming up, that we can reach out to families and let them know, like, hey, there was a cancellation. I can get you in sooner if you can come tomorrow. And so we're working on processes to try to make better use of that time so that we can get families in quicker. Another thing that we're really trying to do a big push for is get our families connected with our One Chart patient portal. We can get families access to medical records, to information so much easier if we can get our families connected in the portal. There are new features when signing up that allow families continued access even after their child officially turns the age of 13 and then 16. And so there's greater access to things I think that initially families were nervous about having access to. So this portal is really a nice tool to keep you in control of that information and have easy access to that right away. We are revamping our satisfaction survey as well. We really want to know what we're doing well, what we can do better, and we want families to tell us. That helps us know where we need to improve. And I know that our satisfaction survey can be a little bit long, and so we're trying to revamp this right now, make it shorter so that we can get more feedback from families and really know what is it that you need and how can we do better to help you. We're also currently developing a parent resource library. We're trying to build that right in the front of the building so that right when you come in, if there are supports that we need to provide family, whether it's computer access for signing up for services, having a person there that can help you walk through that. So this is a work in progress, and we want to continue to talk to our families to see what supports that they want us to build into that. So there are many other things that we're working on. It's really been a fun time to, after moving in this new building, kind of setting our sights really high and tackling big projects, some things that are going to take us a while, some things that'll come real fast. So these were just highlights of things that we are doing a lot of work on right now in order to make some big changes immediately. So I just want to spend some time opening it up for questions. I'll stop sharing here so I can see all of you. So I think, Jennifer, you've got those in the Q&A, right?
I do. So we have, let's see. What kind of referral is necessary for the developmental pediatrics? Is it from the primary care, or can a family do a self-referral?
Some of that might depend on your insurance company. And so we really try to look at specifics from the insurance company. Some departments don't require a referral, and some do. So for developmental pediatrics, that a referral from a PCP would probably be very helpful because they want to connect with the PCP to see how that team is supporting it. It may not be a requirement from an insurance standpoint, but I think that those are definitely both options. Our developmental pediatricians work with Children's Hospital as well. So they spend part of their time at Children's and part of their time at MMI. And so one of the challenges that we're trying to help families with is for young kids coming into the system, maybe for the first time needing developmental pediatrics, that clinic might need to occur at Children's. For families who have individuals are a little older, they've kind of gone over that age of Children's, we want to get you set up at MMI. And so where that location might vary based on the age of your child. But the developmental pediatricians are in both locations.
Do you know how long approximately the wait list is now for a child to get an evaluation for autism spectrum disorder?
That is, let me pull up my data right now. That our longest wait list at this time is for treatment. The wait list for evaluation is not quite as long as the treatment wait list. But what we're finding is that list is a little bit overinflated because we've been calling families on that wait list and they will say, oh, we don't need services anymore. We already have that. So we're working through kind of cleaning up that wait list right now. I know that it's not short enough. And I think that no matter what number I say, it's always going to be too high. But let me see if I can get something a little bit more specific here. We also are trying to improve the process by getting the screener done soon. So there's a couple different options, and this is how maybe our care coordination or our patient information office can help. If you call in, if you've already had a part of the evaluation process completed, if you've already done the initial interview with somebody, if your child's already had a speech and language eval, we can get you onto more of a fast track list so that you're just waiting for that ADOS. Our full autism, comprehensive autism diagnostic clinic is everything all in one. So if pieces of those are already done, we want to get you through that system faster instead of just waiting on that one wait list. So we have the interview that needs to be completed. And then if you need both, if the ADOS and the speech language evaluation, then that's that comprehensive diagnostic. We do our list right now. I've got, we've got over 200 on that screening list, but not all of those are needed anymore. And we've actually seen it decline. So I track these numbers quarterly and we're seeing them head in the right direction, at least for that initial screening, is that our numbers are dropping. We're able to start working through that wait list a little bit faster. I know that doesn't answer exactly the question, but I hope that helps a little bit.
Where can I go to learn more information about the specific pediatric programs?
On our website would be the best place to start. You can go to our MMI webpage, and then at the top, there's a button that says patient services. So that's where I would start, with that patient services. And then there's a red button that says patient services overview that kind of just highlights everything, or it gives you, it's going to give you a little bit more detail than I did today. I tried to lump things together to make more sense of what the general areas are, but that will give you more specific information.
Okay, how does a child get into recreational therapy, specifically for the leisure or swimming skills? Is there a wait list for that? And are these services typically covered by insurance, or are they paid out of pocket?
For rec therapy, you'd call rec therapy directly, and that's that number that was 559-5777, I believe, that was on that slide. I can pull that back up too if need be, but let me double check that. I want to make sure you've got the right number. Yes, 559-5777. So that gets directly to our rec therapy department. I don't know if there are wait lists for aquatics right now at rec therapy. Typically, the biggest demand in rec therapy is summer camp. And so I think that for individual classes during the year, it's probably a little bit easier. Summer camp is always the just most challenging one to get into. And because of that, we're trying to expand number of weeks, number of rooms, so that we can get more people the opportunity to get into summer camp. We do not bill insurance in recreation therapy because it's not a medical-based therapy service. And so what we do instead is we have those class fees. So they're just reduced rate types of fees that we can have families support some of that cost that it takes to provide the service. But if a family can't afford it, there are scholarships. And so when you call rec therapy, you can ask them about the scholarship options that are out there too.
And just to add, since like the summer camp and some of the other programs are considered a respite, you can use the lifespan respite subsidy if you apply and are eligible for that. Also, late breaking news. I heard recently that the recreational department is now accepting waiver funds for respite and maybe some other programs. So, like Dr. Nordness said, just reach out to rec therapy and they will have the specifics on that. But if you are on the DD waiver or the A&D waiver, you may be able to use some of your waiver dollars for that.
Yes, thank you for saying that, Jennifer.
Yes.
I appreciate it.
We were all celebrating. All of us parents were celebrating when that went through. So wanted to make sure and mention that.
Yeah.
Does MMI have a clinic or support in place for transition to adult providers?
So that is something that has really been on our minds for a long time, about improving our services for adults. And every department is being challenged to prepare for that transition. So I think maybe this question leans more towards medical providers, but I wanted you all to hear, at least we're kind of tasking every department with that, regardless if it's medical or therapy services, is that everyone is working on expanding to our adult population. As for medical services, our developmental pediatric support right now, we are focusing on having that be adult population here. We are also looking for new partners to bring in and focus more on that adult IDD population. I think that that's definitely a need that's out there. We'd like to continue to expand. And so I would expect in the future that MMI is going to offer more medical services as well as more therapy services for our adult population.
Okay, regarding the referrals, is there a specific referral form or any specific language that is needed in the referral?
That's probably going to depend on what it is that you're looking for. So one example might be if you needed I'm just going to say speech evaluation. Really, the only thing it needs to say is a speech and evaluation. Typically, after the eval, your therapist is going to know what needs to be written in order to continue to get ongoing services. And so they'll help through that process. It's usually that first time of just getting in the door. What is it that you need? So if some things need those, like psychology doesn't need a referral from a doctor. They can provide that service without. And so they wouldn't need that referral form in order to get started. You can just call patient information office and work to get set up with an appointment there. But for therapy providers, they do need that referral. So typically the best thing is what type of evaluation you want. And then when it comes to treatment, the provider can help with that next step.
Okay, and I know we are getting short on time, so I'm trying to get in all of the questions. I apologize. Is there a reason that MMI is partnering with Boys Town for audiology rather than Nebraska Medicine?
There isn't really a specific reason for that. MMI really just prides itself on partnering with everybody. So we're trying not to be exclusive to one partner or another. We had the opportunity come up that Boys Town was able to provide those services. And so we have happily done that, but there is no reason that it is them over others. And so we are always looking for our Nebraska Medicine, our UNMC, Boys Town Children's. And so this is a place where we will be willing to collaborate with everybody.
Okay, and then crisis services was mentioned under the care coordination. What crisis services does MMI offer?
Yeah, and I think probably in that section, what I really wanted to at least what that really reflects is if a family is really struggling with an event that is happening right now that is keeping them from being able to get to services, get connected with our care coordination department. So typically what we see is if behavior has gotten bad that they can't get out of the house, there's no transportation, if the child has recently not been able to go back to school. And so I think usually it's a family in crisis that accessing services seems so much harder. So not really kind of a crisis like a psychiatric type of model, but more of a family. I don't know what to do. There's too many things going on right now. I need someone to help kind of help work through all these questions. I hope that answers a little bit better.
Okay, and I think we have time for one more here. I have been reading about functional medicine and MAPS doctor in relation to autism and genetics. Is this covered in your neurometabolic clinic, or does MMI have a doctor that falls into this category?
Jennifer, say that one again.
Sorry. I have been reading about functional medicine doctors in relation to autism and genetics. Is this covered in your neurometabolic clinic, or does MMI have a doctor that falls into the category of functional medicine?
At this point in time, I don't believe we have that. And I think the focus on neurometabolic is really going to be steered towards that how food and those that stuff that we're taking in to support our growth in our body that is breaking down differently and is impacting the brain development. And so we're going to have that have a lot of nutrition kind of component to that. So I don't think it's probably what you're thinking about from a functional medicine standpoint right now. I'm not off the table for the future, but currently right now, not the focus.
Okay, I think in the interest of time, it's just a smidge over. So thank you again, Dr. Nordness, so much for all of this health information. Anybody can reach out to me. I can get you in contact with Dr. Nordness if you need to. But if you have any questions, feel free to reach out. I will be sending a follow-up email with some more information in it. And I do have a short survey if everybody could participate. Our funders would appreciate it. Thank
I
you.
appreciate you. And any connection back to me, I'd be grateful for. We're always looking for ways we can improve and do better. And the only way we know that is if we hear from our community. So I much appreciate that too.